easier. So again, the mission is for you to discuss with us what your vision is for healthcare. What do you want this community to have involving healthcare? Either that we already have or that you just believe we should have.
Absolutely.
So we can talk a little bit about that now,
Okay.
or you can give yourself time to think about it. And
Well, I can start talking about it because it's something certainly I'm passionate about, and it's been a challenge for us in the community for many years, as we know. Meeting the needs of healthcare for our citizens. I think a lot of times we have to balance the expectations and also, the rights that we feel that people should have access to healthcare no matter where they live, with the reality of actually making that happen in the business of a hospital. But I do certainly see a future where our residents have access to full health care. And that is something that is a top priority. We're working on it. We're working on it from the top down, from our congressional leaders on both sides of the aisle, Congressman Shamari Figures, and even on the Republican side with, Senator Katie Britt, Tommy Tuberville. All of them understand our need. For one, we've expressed it to them, and we're working on ways to deliver. And that is something that it's certainly a challenge. Again, understanding the business of a hospital, what it takes to get doctors to move here, which you all certainly understand, with the Macon County Health Authority, to get doctors, giving them incentives to come here, staff in hospitals, all the equipment it takes, and even after all that, convincing the community, although there's always an outcry for healthcare, that when it's there, to not skip over the one that's in your county because you feel that for whatever reason it's inferior quality health, to go to that next county.
so I think the biggest challenge, and I'm certainly not a healthcare professional, but I do read a lot. The biggest challenge appears to be Medicare, Medicaid right now.
Yes, absolutely.
And that payment, and of course insurance executives have so much control over even patient decisions that doctors
sure.
make for their patients. Understanding those challenges,
Yes.
you still can see how perhaps a hospital could be in our future.
Absolutely. I still think that, with some federal intervention, I honestly, just straight to the point, think it's going to take that. And I think with the partnership, we have the VA here. We have Tuskegee University as a strong anchor and now even more vocal advocate for this mission, to put some support behind it, put some money where their mouth is as well. But I was in a meeting with Dr. Brown, some representatives from the VA, and even some of our congressional leaders of how really to make this a feasible reality. And I think it's going to take collaboration between all three of those entities. But I think that, from where we're going, I think that we certainly, even from a population growth and all of those things, we will need a hospital in the future. We need one now. But I think it's going to take certainly a commitment of federal dollars, first and foremost, for a full-scale hospital.
Did you know that Thomas Reed was designed to evolve into a full hospital?
I didn't exactly know that it was designed to evolve into a full-scale hospital. So that is actually good to know if it has that capacity to do that, because that might be, the quick answer to a lot of the challenges that we're talking about. There's been talks of some older buildings from the VA to, even from the ground up construction of a hospital, but that facility is there. It's relatively new compared to 20 years. I mean, older than these guys almost. But, compared to a lot of the other options we're talking about, the old Macon County Hospital by the lake, I mean, those buildings certainly would take, that's been just thrown around even as well as renovating, and the buildings from the VA certainly older than that, the ones that are, I guess, currently offline, that, they don't have any use for. So, I mean, that might be a feasible option as well, worth exploring. But certainly, again, I think that just being realistic, it's going to take some federal support from Congress. We have some strong advocates, like I said, on both sides of the aisle, who are listening to us when we're expressing this concern about healthcare, and certainly the need in the community is there. Tuskegee University is going to always be there, and we want to support their growth. We want when parents drop their kids off there, they don't have any concerns about access to health care, and we don't want that to be a determining factor of why somebody chooses another school over Tuskegee. We've seen medical emergencies on campus. Recently, the student Jay Callwood, who passed away, and I think that while we can't prevent all accidents from happening, I think we can be more assured that if we have a hospital in the community, we're going to be that much better prepared to deal with, emergencies that, maybe that will make a difference with, for sure.
So the Thomas Reed is 17,000 square feet. I've
Yes.
heard the vision articulated, and it is to double the footprint, which would make it a 34,000, at least 30,000 square foot building, and then increase the number of services and expand the number of hours. The more immediate goal is to go to urgent care. I haven't
Yes.
heard 24 hour, but I have heard expanded hours with urgent care
Yes.
built into. So there are plans that align with your vision.
Oh, yeah.
And the spirit is so, the synergy is there.
Absolutely.
And I know that board is working very hard. So it would be great, I guess, if everybody could sit down
Yes.
and learn about what is happening. I do know a few things, but I don't want to speak for the board because they haven't authorized me to do that.
For sure.
So if you had to, or if you could, would you give me your top 3 priorities, just bang, 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 in terms of healthcare? You've already said hospital.
Well, hospital is the goal, and I think it's important to state it, even though might be more of a far-fetched or long-term goal. But I think that the pieces will come together. But I'm also realistic in as far as feasibility of what we can do and even do right now to make a difference. And you mentioned urgent care. I think urgent care and having somewhere where even after hours, if not full scale 24 hours, where people can go when they have a health concern, will certainly be an upgrade to what we have here. Something that I'm very, very proud of that is happening right now. And it really hasn't even been full scale announced because we're working on the details. But it came about from a meeting that I had with Dr. Brown of just a few weeks ago, honestly. And even just backtracking from that, the first staff meeting that I had with my department heads here, I told my fire chief that I said, by next budget, I want us to be able to staff an ambulance, have an ambulance here that is, designated to be in Tuskegee area that can cover this community, because we've seen so many times where, the wait times have been too long with the current setup. And so, thinking that might be a year away, 6 months plus away, and knowing that was going to be a cost, I got him to start kind of planning and working on what it would take. We've been training our fire department fire personnel as EMTs, and that's been a big initiative to get a lot of them trained. But I had a meeting with Dr. Brown on campus. This is before even the recent situation with Jay Callwood, but eerie timing of all of that. And, he certainly expressed the same need and concern. He asked me some of my healthcare priorities, and I told him that the thing that I felt like we could do right now was to make sure that we had an ambulance that would be here on site to service the campus, the community, and we need to make that happen. So as a result of that meeting, the university has committed to purchase an ambulance. That ambulance has been ordered and will be here very, very near future. within the next couple months, I'm being told, but I don't want to
Sure.
set the, I know it takes things. Once it gets here, you got to do certain things. But at first, even there was a waiting list and things like that, but was able to get one unit here. And there's also plans to get another one, but we got to get one at a time. There will be a MOU of some sort between the city and the university to where we will be the, and I need to get the exact term, but the ambulance operator, if you will, applying for that with the state. We will have our EMTs, and also there'll be a training component with Tuskegee University students and their program, EMT program as well. But that is something that is coming very, very soon. And I think that is, while a hospital, $20, $50 million, however it's going to cost to do it, I think that's something tangible that we're going to be able to do right now that's going to truly make a difference. I've witnessed it firsthand, ambulance taking a long time in this community, and seconds matter, minutes matter. So I am very excited about that, expanded ambulance services.
Do you have a third priority?
Third priority would be, I would just say, more access to healthy foods, quality, and just education about nutrition and preventative things. A lot of times I think that's the part that people miss out on, being proactive instead of reactive. So, whether we are considered a food desert or not, I think we have so much opportunity to, grow foods and, provide the things to our citizens, and also from an agribusiness standpoint, with the identity of Tuskegee, really use that as something to help us generate some revenue, but most importantly, meet the demand that we have, with our citizens. So, whether that would be grocery store options or expanded, quick food options that are more healthier for everybody. I think that's something that the education piece, we need to kind of rewire how the relationship we have with food and health and disease to try to, close that gap, I think. So we're not having as many healthcare problems as we rank in a lot of those areas. I think it's not rocket science. A lot of times it's related to the diets that we have, so that would probably be the third.
Well, that's excellent.